welcome to Lessons from the Field. And as you know, this is a interview series that we're doing with a diverse array of guests who all have a common thread, and that is a passion for pharmacy and pharmaceutical sciences. And today, we're very happy to have Raihan Pothigara, who is a graduate of our PharmD program 2014.
Mm-hmm.
And he's currently pharmacist in charge at one of the flagship CVS stores in Elmhurst. And he's been working for CVS, I think, most of this time since he finished school. And we're really excited today to talk to Raihan and really get the community pharmacy perspective, which we haven't had as many guests on from that side of pharmacy. So thanks for being here today.
No problem. No problem. The excitement's all mine. I'm looking forward to it too.
And we're just going to ask a series of questions and gain some insight from you on your career, your experience. And I know it's going to be very beneficial to our students and alumni, especially the ones that have graduated more recently and friends of the college. And hopefully some of your classmates are out there and they'll be listening to, and you'll get some.
They'll be listening to it. They'll be shaking their heads, and we'll go from there.
How did you pick this guy?
It's like of everybody in the world. But hey, just the best of the best.
So maybe you could just start off with giving us a brief overview of what you've done since you left pharmacy school the last 6 years or so, right?
Yeah. So it's been quite a ride. So graduating 2014, got fairly immediately, I got a offer from CVS. Of course, not. This is something I had to solicit, so I had to apply for it. But it was out of state. It was in California. So I moved out to California for a couple of years. Got the licensure there, which is within itself an interesting experience. But I absolutely love my time there. Not only because it's California, but also because it was a culture of learning, and it was a very supportive culture within the company, helping you develop, and that's something pretty consistent along the way. But learn a lot from there. Had a chance to come back here because of some personal reasons, and I'm here now, and it's continuing the journey.
Mm-hmm. And so have you been to a couple stores in the Chicago area too? And
over here, I came in 2019, was at Carroll Stream.
Oh, okay.
In a CVS in Carroll Stream, and then I was moved on to Elmhurst from there. Yeah.
And what's the store like where you are? Maybe tell us a little bit about your day-to-day, activities, what you do, and what maybe the role also of the pharmacy manager,
absolutely,
or pharmacist in charge, and how that differs.
Yeah. So the manager or the pharmacist in charge position, you are first off the pharmacist on duty. Right, during your shift. So you have the traditional responsibilities with that. And in addition to that, and when I say traditional responsibilities, just to go quick summary, it's just mostly, of course, dispensing, making sure whatever is leaving your building is safe for the patient. You have a big teaching portion of it. You're teaching people how to use the medication correctly, helping them with access to meds, et cetera. So the other portion, of course, is the management side, which is, adds on a little bit more spice to your life. We have just the daily or the weekly or the monthly things you do. Mm-hmm. You have the staff portion of it where you were, hiring, a lot of hiring, just a little bit of firing. You have some sort of team development and, making sure people's behaviors are correct, making sure the service mentality is there. For pharmacy service, and just making sure that people's values when they're in building match the values of the organization you work for. So that, in a nutshell, is what I do. Yeah.
And the store that you're at, I know it's a little higher level one in terms of the services you provide. What are some of the extra services or some of the clinical things that you're doing there?
Yeah. So as part of the 24-hour pharmacy, so of course we have the around-the-clock pharmacy service that we provide in terms of dispensing. We have, of course, immunizations. With the pandemic, we have testings going on. So with the store, we're assisting with, both the lab testing and also the rapid testing with COVID-19. So it's a great resource for the community that goes on for most of the day. In addition to that, we have some clinical programs that we have within the store where we actually reach out, to focus on gaps in care, focus on adherence calls, making sure people stay on their meds. We have immunization gaps that we like to discuss with our patients. Testing A1C, we have some programs where we reach out to patients who are eligible and just talk about, for example, we talked about A1C, we talk about kidney care, we talk about eye exams for people with diabetic patients. So it's a pretty well-rounded. I think again, not just a shameless plug for CVS, but I think CVS is doing its part in making sure people are well taken care of.
Yeah. I mean, obviously you must be really busy right now with the pandemic and the vaccine and everything.
Yeah, and it's easy to, it's all about mindset, right? So if you look at it from the angle of really being there for folks during this, unimaginably tough time. So we're glad we're out there.
Yeah, we are too. So, I mean, a couple questions I wanted to ask you. One was about your time here and how that helped prepare for your career. But maybe before that, is there anything else you'd like to kind of just share? Thoughts you have on whether it's from your experience so far or generally with our current students?
Well, we would need more than a half hour for that, Glenn. I definitely have a lot on my mind. So, but I would definitely let you guide through the conversation. But really, nothing major. I think there's a lot out there for students. So let's reflecting on the time with UIC. I'll tell you, it's been a great time and it's a great resource, right? For anyone, any of the students listening to this, any of the alumni listening to this, it's something that's an open book where people have a wealth of experience and a wealth of knowledge where students can tap into. And it's a lost opportunity if you don't. I commuted to UIC, right? I was commuting from Hanover Park, Schaumburg area. And of course, you have a lot of lectures, and at the end of the day, I just want to go home. So try to beat that mentality. Try to stay on longer, get involved with organizations, and you will see that you will never regret that decision. So spend a 12-hour day in Chicago now and then, and you would definitely enjoy that.
Yeah. So what are those organizations, or what was the takeaway from some of the activities that you did outside of the classroom that really helped you in terms of your career?
Well, it's putting what you know into practice, right? So there's a difference between, listening to someone and learning the knowledge. And of course, in UIC has this fantastic experiential department, right? We have legends who work there. So outside of that, with organizations, you have your upperclassmen who can help you guide you to maybe work on some projects, how to talk to people, how to present information. And in the end, as a pharmacist, you're only as good as how you can coach someone on how to properly take a medication, for example. So it's a combination of those things.
Yeah, no, that's so true. I mean, you can only be effective as you can communicate that information.
Absolutely. So putting it into practice, working with people, working as teams, it's an interdisciplinary approach everywhere you go. Even if you're thinking, oh, you know what, I'm going to community pharmacy. No, you're working with nurses who are most likely in the building. You're working with different professions. Learning to work together is definitely a skill everyone should continue to build on.
Yeah, you were telling me earlier that when you were at school, you had some interactions and spent some time focusing on, I guess it was the consulting pharmacy piece, but elderly and working with Dr. Kornikowski and others.
So with Dr. Kornikowski, just extremely supportive person, and of course, and Dr. Ann Kupta too, and just like everybody else, really. I can't point out one person and say, hey, you know what, that's a bad professor. And at least I wouldn't say that in front of you. Anyway, with Dr. Kornikowski, it was as simple as me sending him an email, joining an organization where he was a mentor, right? And he would just tell me, okay, you know what would you like to do? This is what I'm interested in. and he would give me a sample, something to work on. So one of the things he asked me to work on was, okay, let's look at these over-the-counter ingredients and compare that with guidelines on, let's say, Beer's criteria for adults, for seniors, for drug safety in seniors, and what are some of the recommendations you can pull up. So that's something as simple as that. And being in the community pharmacy, I deal with that every day.
Yeah.
So
Yeah.
I get a lot of questions about over-the-counter meds, and of course, good portion of those folks are 65 and above. So you tailor your counseling based on that, and that as simple, something that's simple, at least it looks simple, but that's something I would carry on for years, for the rest of my career. So
Let's look back on that as a very enlightening period. But
yeah.
So you've been out and you went to California, and now you're back in Illinois. I mean, you've worked at a number of stores, probably interacted with a lot of different people, and obviously thousands or hundred thousands of patients.
Maybe, I don't know.
What do you feel like has been the the most significant in terms of impact that you've had, or where do you feel like kind of the proudest about what you've been able to accomplish?
So looking at the environment I work in, so I'm coming from a community pharmacy perspective. I think, Glenn, access to meds is the biggest challenge, and it's the biggest impact. Yes, you are there to make sure medications are taken safely, effectively. However, when it comes to access, that stops a lot of people from taking their meds, right? So I know that was a big it still is a big priority for CVS in general. They have a lot of programs for that. But as a pharmacist too, how are you going to help someone get that medication, right? Drug costs are on the rise, and I'm sure that's a discussion happening in UIC every day. And, we have a lot of players involved, and the common man is being affected. So when it comes to access, not only in terms of cost, but we're also talking about deliveries. How do we get this person the medication? If someone is comfortable using blister packs, medication pouches, etc. So the most significant impact, I think, in my setting I can have is allowing someone to have the ability to get their medication on time, get it effectively, make sure that that cost makes sense so they can come back and continue that medication, right? Help them find coupons, etc. And that is something that is common for all age groups. It is common for all income levels, right? Everyone is affected by drug costs and drug access, and we're doing our part. So, I was in California, I was in nicer areas, I was in, you could say, middle class areas, some low income level areas, and it's the same, it's consistent throughout. So as a pharmacist, you're not only there for the meds, of course, it's coming out of your building, but you want to make sure that the person is satisfied with getting that and can come back and get it again, so that's I think is the biggest.
That's so true. I mean, without that, there's nothing, right? I mean,
absolutely. You could have all the inventory in the world, but if someone can't pay for it,
it's not going to help them. Yeah, the pharmacoeconomics class that you took here came in handy a little bit.
Oh yeah, absolutely. Yep, absolutely. No, definitely. That's the one thing that is so beautiful about the pharmacy profession is it dips a little bit in every healthcare challenge, right?
Yeah.
You have it takes a little bit out of, and you experience that overall as a pharmacist, and I'm sure as many other mid-level practitioners would experience. You get to see the bigger picture a lot more.
Yeah. Right.
So,
yeah. So, stepping back a little bit for our students and maybe also our recent graduates, we always ask the people we interview, like, what tips you might have for them in balancing their jobs and their career and then also their home life. And now you're in a demanding position as a in charge, but how do you balance that with everything else you want to do in your life and staying healthy mentally and physically and so forth?
The mentally healthy part is always a challenge. I was just kidding. No. Yeah, it is. It is just like any other healthcare profession. I think this is a demanding profession. So, regardless of where you are in whatever setting, you always have some level of stress, which is falls onto how you want to have that affect you, right? So over time, and this is a learned skill, I didn't come out of college and I didn't come out of UIC saying I know how to do a work-life balance, right? I'm a very different manager than when I was the first pharmacy I managed. So you set your limits. So one tip I would have for UIC students, again, talk to the people around you, talk to professors. You have so many amazing people who came on this series. Reach out to them, talk to them, and see how they manage the work-life balance part. You, as a manager as a pharmacist in charge, there's some work I take home, but you have to constantly remind yourself that you have to set a limit for your own mental, physical being, and try to balance it out with I have a beautiful family. I have 4 children.
Oh,
And,
great.
yeah, I'm running a 24-hour pharmacy at home too now. So so you have to have, over
Yeah.
time you learn that you have to have that split up. Again, talk to the people, and this again comes from, you could read 100 books on it. In the end, you practice it. So a lot of the students are already working part-time. They have internships, they have externships.
Right.
And if you ever need help, you have so many great people around you in UIC. Just reach out and seek help.
Yeah, great advice.
Yeah.
Well, Raihan, I mean, it's so obvious in talking to you how excited you are about your career, and you obviously love it, and you love what you do, I think, and I'm sure that shows in your interactions with patients and your coworkers.
Mm-hmm.
What else do you get excited about pharmacy, or where do you see opportunities for students in the future, especially in the community environment?
That's a great question. That's a curveball, Glenn. You gotta let me.
I told you I'd
You
throw in a couple.
you gotta let me know. You have to give me a week advance on this question. No, I was just kidding. No, I think the experiential side that UIC has designed does allow someone to look at a lot of different angles, right? One thing I would say again is never be afraid to reach out, never be afraid to seek help. We have, I would say, this is just a general advice, right?
Yeah.
You will have people who will tell you, hey, don't do an advanced residency, not enough spots. You'll have people saying, this environment is bad for you, don't pick this type of pharmacy practice, right? So I would just in general say what helps you realize and have a clear path forward is have a clear mind. Ignore the negativity, ignore whatever someone else is out there saying about how bad the environment is, or will we have a job in 10 years. No, you make your own path. Hard work is the only constant in success. So work hard, throw yourself into the fire, not literally, of course, but throw yourself into the fire, take the tough road, and automatically it will force you to make connections, and it will force you to find solutions that way. So ignore the negativity and really work your behind off, and see where it takes you from there.
Yeah.
Find value in what you're doing. And that's, just going off to your question, Glenn, that's one thing I love doing is when I see interns, when I see students come in, a lot of them have this concern, and I see this pretty commonly, and it's sad. It's sad where you have Debbie Downers who are pharmacists already, and they would discourage kids from doing pharmacy school, which is shocking to me, right? You would have some people who would tell students to not do a certain type of pharmacy profession, and I would tell them to ignore that. And I love having these conversations where I tell them, you got to add value to what you're doing. Look at what value you provide, as opposed to why do I have to do the same thing again and again, right? Yeah, I have dispensed maybe 1 million amoxicillin scripts, but I don't look back at it and say, why do I have to do the same thing again and again? Be a part of someone's recovery, right? Be a part of someone's recovery story. Look at what value you bring, how much money you're saving an organization, how much more efficient you're making a workflow, how much more access you're bringing onto meds. Yeah. These are the things you need to look at, as opposed to will this be here in 5 years? Don't look at
Yeah.
that. If you create value, people will make sure you stay. That's just one advice I would give
Yeah,
out.
that is great advice, Raihan. I mean,
Yeah, that would just be
focusing on,
$10.
yeah, I mean, focusing on what you're actually doing, not the, fill in the
Not the task.
prescription
Yeah,
or whatever the
exactly.
task, but
Exactly.
what's the outcome of that? How
Yeah.
are you
Yeah.
helping
So
people?
yeah, absolutely. You would have filled and dispensed maybe a billion metformin tablets by now, but again, look at how much, let's say, glucose control.
Yeah,
How much are you helping someone stay healthier? How much are you helping them reduce that dosage, et cetera? So those are the things, I know we like to celebrate at UIC, and those are the things that people should really focus on as students, and seeing what mark and how you can provide a value to an organization. Even if it's, let's say, you're doing an externship with the VA, what value can you bring, and reflect on that value.
yeah. Wow.
Yeah.
Great stuff. This has really been fun, Raihan. It's,
Hey, no problem. It was fun for
yeah,
me also.
yeah, great catching up with you and getting your
Same here.
advice.
Same here, Doc.
Really appreciate you taking the time. Hope,
Problem.
hope your career continues to do as well as it has, and that you enjoy your family and
Oh, thank
everyone's
you.
safe and happy. And
Thank you.
thanks
Thank
for
you very
your
much.